Insecurity affects far more than what's on the table, the dinner on the table. It can really take a toll on your mental health as well. Right now, a lot of families, they're feeling that strain nearly a week after SNAP benefits were cut and they went into effect on November the 1st. This morning, Dr. Morgan Francis joins us live to talk about how food insecurity can really impact a lot. Anxiety, sleep disruption, family disability as well. The list is long on what these families are facing here.
It really is. This is a family that we are going to be seeing so much chronic stress. And what we were talking about a moment ago is that there is such significant uncertainty. And when a family is going without food, they have to make that choice between being able to pay for food, being able to pay for their own shelter. And that's a really hard position to be in. And that could definitely affect anyone's mental health and their medical health.
Not only are we dealing with just losing those food benefits, you touched on the uncertainty. Mm-hmm. Does that add to it? Because, we keep hearing it's not funded, it's partially funded. You could get half, you might not get half. We don't know when you're going to get it. Does that add, I would think that would add to the mental stress in all of this.
Yes, it creates severe anxiety because there's so much unknown. And so when you have that opportunity, you're going to try to get whatever you can. It's not about nutrition, it's about survival. Food itself is meant to provide stability and safety. And when that safety is at a threat, which it is right now, the amount of trauma a person can experience is insurmountable. So what we see is that parents will have to forego their own meal in order to give their child the meal. So mothers will go without, and that is a crisis.
So what is somebody in this situation, what do they even do? I mean, obviously they go to food banks and they try to compensate that way, but then the mental health, how do they even start to, I guess, jump over that hurdle?
Well, it really takes community. So we as a community here in Arizona need to help those that are in need. We need to be donating to food banks. We need to provide our time at these homeless shelters that are around the valley. We need to give our time to our local church and be able to help those. There are wonderful grocery stores, even small business owners here in the valley that own restaurants that are donating. So the more that we talk about this, the more awareness that we can bring to people, and anything you can do, even if it's small, is a way to help out and support those families so they don't feel alone.
What are the effects later on in life? I mean, I have friends who, they grew up in tough situations, and that still impacts them today. They still remember those really tough situations. Yeah. And so for these young people who are going through this, is this going to carry over in life as well?
It does. And we see hunger at its core affects our blood. It affects our neurological development. It affects our sense of safety, and that can get passed down from generation to generation. And we've seen this a lot in research. We also know that they are being set up for disordered eating, potentially eating disorders, because again, there's such a restriction, they can't eat. So when they do eat, they'll get as much as they can, and it's not about nutritional value. It's about what can I get that's cheap, that's affordable, and is going to get me over for the next maybe 2 to 3 days because I don't know when my next meal will take place. And they lose their focus, they lose their concentration. I mean, I know there's been times where I've gone through a hard day and I'm like, wow, chocolate sounds really good right now. Right. This is nothing to comparison what somebody is experiencing. So them going for food that's quick, that's cheap, that's affordable is really what matters here, not what's nutritional value. So we need to have some sensitivity around the fact that these people are really going to be struggling.
If somebody's watching this and they're like, I'm struggling mentally, I'm hungry and I'm struggling mentally. We have food banks and everything like you're talking about, but what mental resources are there for folks if they're struggling?
They can talk with people that are in the same situation as themselves to know that they're not alone. I know that may sound counterintuitive, but feeling like you have to keep this, all of that anxiety in can be detrimental to your medical health and mental health, so it's important to talk to others. And if there are local social workers, community agencies for mental health, I would encourage them to talk with those providers and talk with members of your church. Find help and faith in your local community and your church.
Yeah, something we're still going to be talking about in the government shutdown, now the longest in history, day 37. All right, thanks, Doctor.
Thank you.
Appreciate you coming in.